My name is Evan Blake. I'm a writer for the World Socialist website and the coordinator of the Global Workers' Inquest into the COVID-19 pandemic. I'm joined today by Dr. Benjamin Mateus, a practicing physician and our lead writer on the pandemic at the WSWS. And we're happy to have Dr. Jose Luis Jimenez on the call today. Dr. Jimenez is a professor of chemistry at the University of Colorado, Boulder, and an expert in aerosol physics. Throughout the pandemic, Dr. Jimenez has been a leading advocate calling on the World Health Organization and world governments to acknowledge that SARS-CoV-2, the virus that causes COVID-19, largely transmits through aerosolized particles that can linger in the air for hours, and less so through droplets that quickly fall to the ground. In July 2020, he was one of 239 scientists who signed an open letter calling on the WHO and other public health agencies to acknowledge the role of airborne transmission and to educate society on how to protect against this. And along with his colleagues, he has written numerous publications on this topic. Dr. Jimenez, thank you for joining us today.
Thank you for having me.
I'd like to begin by discussing the present situation with the rapid spread of the Omicron variant. In the span of 1 month, Omicron has become dominant throughout much of the world. According to projections from numerous scientists, a disaster is unfolding that will dwarf all previous surges of the pandemic. This week, the Institute for Health Metrics and Evaluation forecast that more than 3 billion people, or roughly 38% of the world population, could become infected with Omicron in the next 3 months alone. Scientists are warning that Omicron could be the most transmissible virus ever seen, even worse than measles. For Omicron to spread at the rate that it's spreading, it's clear that it must be an airborne respiratory pathogen. We know that the nature of the virus did not change from the ancestral type, that it's been aerosolized from the beginning. However, the powers that be are doing nothing to stop the spread except tell people to get a booster shot and take a rapid test before seeing family for the holidays. To this day, there's not been a single speech given by any politician or public health official in which they have clearly stated what airborne transmission is and how to stop it through the use of high-quality N95 masks or better, improved filtration and ventilation in indoor spaces, CO2 monitors, and more. In fact, in the face of the coming Omicron surge, there is a deepening effort to trivialize mass death. 5.4 million people have officially died worldwide from COVID-19, and the IHME estimates that the real figure is likely 12.5 million. Thousands of children have succumbed to the virus, including over 1,000 in the US alone, largely because they've been sent into overcrowded, poorly ventilated schools where they've caught the virus. Thousands of healthcare workers have died because they weren't provided with N95 or better masks or elastomeric respirators. So, Dr. Jimenez, with that said, my first question for you would be, what are your thoughts on the present situation with Omicron and the continued refusal to educate the public on airborne transmission? And I know you'll go into this further in your report, but if you want to briefly elaborate on what airborne transmission is, I think that would be very helpful.
Yes, well, I'm worried about the situation, about the lack of response that you summarized, because it seems that Omicron may be the fastest spreading virus known to man. Not necessarily the most transmissible in the scientific sense, but because it's quite transmissible, and then the time from one person getting infected to the time of that person being infectious is very short, and we have exponential growth, is really growing very, very quickly. Now, what is airborne transmission? Airborne transmission means that you're breathing in the virus. Basically, the virus is floating in the air and you're breathing it in. And the virus doesn't come out alone, it comes out of people enveloped in saliva or in respiratory fluid, which is the liquid that wets our nose, our lungs, and comes out and floats in the air like cigarette smoke. And what's an aerosol is a little ball of liquid or solid that's small enough that floats in the air like smoke. When someone smokes, the smoke doesn't fall to the ground, it floats around, it's carried by air currents. That's an aerosol, right? Which situations do we get infected? Especially in two situations. When we're talking to someone without a mask, because then we are inhaling a lot of the air that they are exhaling. Imagine you are talking to someone and you are close and they have eaten something with garlic and you smell the garlic, right? You smell the garlic because you are just inhaling the air that has just left that person, right? And then if that person is infected, you are inhaling the virus in very high concentration. That's dangerous. That's the most dangerous situation. We have a lot of transmission in close proximity. Now, there is another situation if it's floating like a smoke and it's not falling to the ground, and you are indoors, you are basically in a box. The walls and the ceiling trap the air, and then that smoke, the same as if there was a smoker. At the beginning, you see the smoke, but after a while, you smell it, and the smoke fills the room. And if you are sharing that air, you can breathe enough of that air to get infected. And basically, every super spreading event, which are very important to this pandemic, like the choir we studied or many others, they are all the same thing: people sharing indoor air. Right? This is an indoor pandemic. That's very clear. So there are those two situations that we have to avoid. Now, we have known this for a long time. And even now, for example, yesterday, finally, the chief scientist of WHO said, yeah, this virus is airborne. But there is a complete lack of following through with measures. Like, it's not rocket science to stop an airborne virus. We have known how to do it. But there is basically a refusal from the political establishment to do it, and from WHO to say it clearly.
No, absolutely, and I think just the way that it's been presented, it's they make very sort of brief references to wearing your mask, but there, as you said, there's no real effort to to explain the science. Even what you just explained, that sort of basic overview, has never been stated on on public television, on social media outside of scientists like yourself, and I think it's really horrible, and it's created this situation where people don't understand how to protect themselves. They don't understand why they get sick, and so you've just I think in particular right now with the situation with Omicron, there's just billions of people all over the world that don't that are really vulnerable. I guess I was wondering, could you comment on maybe your thoughts on what people can do to protect themselves at present with Omicron, and how do you feel that it's different, that more measures need to be taken to stop airborne transmission?
Well, I mean, I think partially depends on the level of risk of each person and how they how they value not getting infected. I think for older people or people who have not been vaccinated, or they have been vaccinated with one of the vaccines that wear off more quickly, like AstraZeneca, Johnson & Johnson, or Sinovac, Sputnik, I would treat this as a high-risk situation, and I would assume that unless you are very careful, you are going to get infected with Omicron because it's spreading so fast and it's so transmissible. So then, I mean, personally, we're kind of back to March 2020. We were going to meet family. We were going to drive to another city and meet with a lot of family, and we canceled it because it basically didn't seem safe. And I would say at the bare minimum, you should get high quality masks that fit well to your face, like N95 in the US, or FFP2 is the way they are called in Europe, that kind of thing, and wear that at all times when you are indoors, but try to minimize time indoors to the extent you can, and then focus on ventilation, which means opening the windows and measuring CO2 so if there is virus in the air, it goes outside. And in some cases, if you cannot ventilate, then filtration is a very good measure. Just like a mask is a filter that we wear, and it filters the air, meaning it removes the virus from the air. You can do the same with a fan that you plug into the wall, and it passes the air through a filter and it removes the virus from the air. So all of those are very good measures. But when a virus is so transmissible, and when we really have not educated people about this for a long time, and we haven't distributed good masks, and there is a lot of counterfeit masks and whatever. I think being very careful and limiting contacts is essential, because it's easy to make mistakes. I mean, even in my own family, we're very careful, but I mean, we have already done 10 or 12 rapid tests of different family members because, we were not sure if maybe we could have got infected despite our precautions. So thankfully, they have all been negative so far.
I was wondering, one of the issues that has come up a lot recently is that, the Biden administration, the CDC, basically all of the officials in the US, but also globally have really, been encouraging holiday travel and really, telling people that if they're vaccinated, if they wear a mask, without specifying what type of mask, that it's safe for them to do that. So I was wondering, as an expert, what are your thoughts on air travel? They're forecasting that there will be more flights than before the pandemic. So I guess could you speak a bit to the dangers involved with air travel? I know you and other scientists have brought CO2 monitors onto planes that show they're not as safe as claimed.
Yeah. Modern airplanes, like 737, whatever, they have very good filtration that's lateral, and they filter the air very quickly, so that's good. The problem is you can still be infected from the people around you if they remove their mask to it and you remove your mask. And there are outbreaks, and they typically follow that pattern. Is the people on the same row, the row before or after, that kind of thing. Now, that filtration is not on all the time. We work with aerospace engineers, and they tell us normally it's only on when you are in the air, but when you are boarding or you're on that bridge, when you are getting into the plane, or an air travel often involves being in a taxi, in a bus, in a train, in a terminal. You are sharing the air with others in many situations, and some of them have good ventilation, many of them have not. And the fact that they don't encourage good masks is very problematic. I mean, there was just a few days ago, one WHO official put a picture on social media of herself wearing a cloth mask that WHO had just issued with the WHO logo that clearly had huge gaps, and it was very dangerous. If she was infected, she would be infecting other people. If there were infected people, she could get infected. And and many of us complained, and the response was defensive. They didn't understand, So this is a WHO official, and they still to this day don't quite understand how this virus is transmitted and what the implications are.
Yeah.
I wanted to follow up the discussion that Evan Blake has raised on Omicron. I mean, so it showed up on, at least it was first detected on November 9th, Botswana. The World Health Organization declared it variant of concern and designated the B.1.1529 Omicron. Everywhere it begins to seed, we hear about a person flying, arriving, detected Omicron, and within 2 to 3 weeks, it becomes the dominant strain in that locale. I mean, the spread is phenomenal, never seen before levels. As an aerosol physicist, and maybe with your colleagues, certainly it's a property of the virus, but can these measures, masking, ventilation, even be sufficient enough to curb, stem, or prevent infections when something is so infectious as Omicron?
They could if we did them in a way the spread monitored rigorously. Now, that's not what we're doing. You just have to go outdoors or look at the TV reports or press reports and the pictures from many locations. I mean, the masks that people wear, I would say 95% are not adequate. There are maybe, they help. Any mask is better than no mask, but many of them are 20%, 30%, 40% efficient. So if we all wore well-fit N95s and they were 90%, it would really make a difference. The same with ventilation. The government said, yeah, you have to do ventilation, but then we basically have an army of people with CO2 meters, and you go, it's everywhere in the world. Most indoor spaces are poorly ventilated, be it doctors' offices, dentist offices, hospitals, schools, trains, churches. So, you know, that they have said the right things, but there is no follow-up. And the follow-up is not difficult. You know, this compared to the economic losses of the pandemic, buying CO2 meters and good masks for everybody in a country is much smaller, but they refuse to do it for whatever reason.
Yeah. Well, I think we'll come back to some of these issues later on in your report. But I know, Dr. Jimenez, you've prepared an extensive report for the Global Workers Inquest into the COVID-19 pandemic. So would you like to begin going through your slides?
Okay, so I'm going to talk today about airborne transmission and in particular, a little bit of the history of what has WHO and governments done and what the consequences are. And there are all these links here that I can also provide, have more information that expands on what I'm going to say. Okay. So first of all, let's review again, how does transmission happen? So this is a respiratory virus. So it's going to be present in our saliva and our respiratory fluid, basically on the surface of the cells and the liquid, the mucus on the nose, the trachea, the bronchi, the lungs. And from there, it has to reach another person. Right? It has to reach the mucosas or the lungs or the eyes, right? So it can do so, especially in one of three ways, right? And there are other minor ways that are uncertain, but these are the three that have been discussed since the beginning, right? One is through surfaces, right? This person, for example, who's infected has touched their nose and then they touch their phone and then this other person touches the phone. And after touching these infected surfaces, they transfer the virus to their eyes through the inside of their nose or the inside of their mouth. And that can lead to infection, right? At the beginning, we were told this was very important, but as of today, there is 0 demonstrated cases of surface transmission. And there are many, many cases where we have cameras and they haven't caught yet one case of transmission through surfaces, right? If it was driving the pandemic, it wouldn't be so difficult to catch. And CDC has been saying for more than a year that is unimportant, not impossible, but unimportant. So then we're left with 2 ways that go through the air. It's basically little balls of saliva and respiratory fluid that leave one person and reach the other when you breathe, when you talk, when you cough, when you sing, you know, any of these activities. And they are divided in 2 types, the big ones and the small ones, right? In this field of science, the big ones are called droplets or drops, and they drop. You know, they fly like a projectile, and they infect if they hit you inside the eye in this very small exposed part of the nostrils or inside the mouth, right? And you can see them, they're big enough, they are 1/3 of a millimeter or something like that. And you can see them with the proper light when someone is excited, when someone coughs, you know, this microspit can fly. And this is a plausible mode of transmission. If you get hit by a cough, you know, from someone who's infected, you know, I would be worried if that was me. There is another type of transmission, which is, or another type of these projectiles or these little balls, they are not projectiles, which is what we call aerosols, right? And they're just smaller, you know. When they are big, they have a lot of inertia, so they fall through the air like a projectile, and they fall to the ground because they feel gravity very strongly. When they get smaller, like cigarette smoke, they still are much bigger than the virus, so they contain the virus, but then they float in the air. They are not heavy enough, and the air motions keep them aloft for, you know, minutes to hours, right? And then the aerosols don't infect by impact, they infect by inhaling them. We breathe them in, and they can deposit in the nose, in the lungs, and from there they can initiate an infection, right? At the beginning of the pandemic, we were told, so we know already surfaces are not important, but WHO told us that it was the droplets, these projectiles. And they have a video that's still on their Twitter account, where you see this person and there is these droplets, these projectiles coming in, and they impact this person, and then infection ensues. And they were explaining that, you know, once you keep your distance, the droplets fall to the ground, and then this person is completely safe, right? So this was one reason why for many months, WHO told us that masks were not necessary if you could keep a distance, because the droplets were going to fall to the ground and they were not going to reach the other person, right? The problem is that this is not correct. They took the fact that infection increases in close proximity as proof of droplets, when droplets, these large droplets, are only one hypothesis. They are not the only explanation for this phenomenon. So what did WHO say at the beginning? Well, basically the words they used were the same words they still use for the flu, right? Basically, it's like, to them, it seemed that the COVID-19 at the beginning of the pandemic was spreading like the flu. And they said, well, it's droplet like the flu. And if you look at what they say for the flu at the CDC or WHO, they say, well, it's these droplets up to 6 feet away, and they are projectiles, and they can land in mouth and noses, or it can go through surfaces. So you have to wash your hands and all these things, right? Now, the problem is they were writing one thing. At the beginning, the transmission was similar to the flu. The error is that the flu is not a droplet surface disease. It's also an airborne disease. And we actually had the evidence before the pandemic, but the same scientific resistance that we have faced with COVID-19 was making this understanding not possible. So then there was some, at the beginning of the pandemic, there were some reports out of China that the virus may be airborne. And, Tedros, the Director General WHO, said this in a press conference. And then someone, Mike Ryan, the number 2 at WHO, gave him a note and said, no, it's droplets. I mean, we know now that former President Trump told the journalists that you inhale the virus. So, certainly it seemed that there was some debate, at least, and some discussion that the virus was airborne. But in March 28, 2020, there is a pivotal moment. The WHO goes yelling on the rooftops that this is false, that this is not an airborne virus, it's from droplets that fall quickly to the ground, and is not airborne. And they were feeling so confident about this that they said that it was misinformation. To say that the virus was airborne was misinformation, right? Now, we have later learned that airborne is the only important mode of transmission. So this is one of the biggest errors in the history of public health. And the people who made this error, who are still in charge at WHO, don't want to lose face and admit it. And that's one of the forces that we will see playing out throughout the history.
If I could pause you just for 1 second, Dr. Jimenez, I think these are really critical points. And just these initial months are really significant, from January to March 2020. And I just wanted to, you referred to this, but the discussion that Trump had, it was with the Washington Post journalist Bob Woodward. And this was later, the revelation, I believe, came out in September 2020. But on February 7th, Trump had a discussion with Bob Woodward only hours after he told Woodward that he had spoken with Chinese President Xi Jinping earlier that day. And Xi Jinping had informed Trump that as Trump said, quote, "It goes through the air, Bob. That's always tougher than the touch." And so based on this revelation, Trump was informed by the Chinese president that COVID-19 essentially was airborne, that it spreads primarily through the air. But he refused to tell the public. Woodward waited until September for this leak to come out. You also referred to this video, this press conference. I forget the exact date, but it was, as you said, in February, where Dr. Tedros Adhanom Ghebreyesus, the Director General of the WHO, said that COVID is airborne, and then Mike Ryan passed him a note. And he then changed what he said and said that it spreads through droplets, and that he had misspoke. I know that video recently was distributed again on social media. Last month it was widely circulated. And I guess I was just wondering if you could elaborate a bit on those. I think just those 2 months or 3 months from January to March were really critical, leading up to this tweet, which is really infamous among people that follow the science of airborne transmission.
Yeah, I mean, you summarize well what we know. It's hard to know exactly what happened behind the scenes. I can speculate based on what I know better. I think there was a debate among scientists and among infectious disease experts whether it was airborne or not. And I think the crisis became so big in China Well, I should say the infectious disease, the people who are in this field were adamant that this was droplet and not airborne. And, and that it was like the flu and whatever. But I think in the case, my speculation is that the Chinese president, this was a national crisis, and he was talking to scientists who were not only from that field, but some other scientists that were more open-minded and were realized that it was airborne, and he told Trump, and Trump shared that. But that then the scientists that were kind of in control, once the issue becomes maybe less of a high profile, and the scientists that control the CDC, that control the WHO message, were all from this dogma that it was droplets, it wasn't airborne, that it was similar but was not the same, and that they basically imposed the will.
Yeah.
And that is my impression. So it's, because sometimes people say it's a conspiracy, they have known all along. I think the scientists that were advising Tedros or that were at the CDC that had power at those institutions genuinely believe that it wasn't airborne. That's at least my impression.
Yeah, it strikes me that Trump knew very, very clearly based on what he told Bob Woodward. But I guess I was wondering, in your opinion, if during that time, if at early February and throughout February, if how many lives could have been saved if there were could the pandemic have been ended during those months if there were education on airborne transmission, the promotion of masks?
Yeah, that's the really sad part of all this, is that I'm certain millions of deaths, and I don't think we would be having this discussion because probably the Omicron variant wouldn't have developed.
Yeah.
It has been, this pandemic, we have failed to control it time and again. Every country where it gets, it explodes, makes a wave. And why? Because we are not doing the right things. We're wasting our time and effort and money. It's not like we are not doing things. We're washing our hands, we're putting plexiglass barriers, we're disinfecting everything, we're wearing, not so good masks. So we're doing a lot of stuff, and people are very tired of doing all those things and to having all those restrictions, but we are not doing systematically the things that do work. Yeah. So that is really sad, and the cost of having said at the beginning of the pandemic is airborne and having put the measures in place, would have been so much smaller than the economic, human health and everything costs of the pandemic, mental health, all them.
Dr. Jimenez, just to continue with this line of discussion, I think Donald Milton from University of Maryland had been conducting studies on the flu and had come to the conclusion that even the flu was airborne, and the CDC had acknowledged, I think, some of that information even before the pandemic. It seems to me that this acknowledgement that these are respiratory airborne infections leads to a certain approach to how to control the pandemic or outbreaks as compared to respiratory droplets. To what extent did the implications or the implication of airborne disease have on the nature of how this was being messaged and discussed? Certainly, as you have mentioned, the world was not prepared for an outbreak of this magnitude, and an airborne disease would require a completely different pandemic response. Maybe you could speak to that.
Yes, you mentioned Professor Milton, with whom I've been working together and in the group of 36 scientists. I think him and many other scientists had provided proof. In fact, we have more proof that the flu is airborne than we have for COVID, and much, much more than we have for measles or tuberculosis, which are diseases that everyone agrees are airborne. So we had the evidence. But there is an anecdote from a doctor who told me, I went to a conference in 2018, and Milton presented some of the evidence that the flu was airborne. And then I came back to my hospital and I told the infection control people, this was in the US, and they said, oh, this is crazy, And to this day, you go to the CDC webpage today, and the word airborne or any description of airborne transmission is completely missing from the flu page. So this was published in scientific papers, but really had not been accepted at all by the scientists who control public health on this topic. So when the pandemic starts, and to them it seems that it propagates like the flu, to them that means droplets. And the idea that the flu was airborne was considered outlandish.
Yeah, no, I think those are really critical points, and it would be good to hear more if you have other sort of details on the development of the science of airborne transmission before the pandemic. I think that's really critical. Would you like to continue on these slides? I know you have a lot to go through.
Well, anyway, so that early development, I think, as we just discussed, was very important. But then we get to this point, which is still early in the pandemic. In March, the first wave hadn't exploded in most countries, and we are told unequivocally that this goes through droplets. We don't need masks. We need to wash our hands and keep distance, and that to say it's airborne is misinformation. And this has not, to this day, as we'll see at the end, has not been erased from the minds of people and public health officials.
This tweet still exists. They haven't.
Yeah, this tweet is still there, and we've asked WHO to either delete it or write another tweet saying that this is now known to be wrong, and they have refused.
Yeah.
I probably have asked them directly 20 times, and so have others, but they refuse.
There was also the interview recently on MSNBC. You probably saw that. The reporter Mehdi Hassan asked Dr. Peter Singer to comment on this. He's a special advisor to Dr. Ghebreyesus, the head of the WHO, and he did not say that they would take it down. So he acknowledged airborne transmission, but didn't agree to take it down or really change the sort of the messaging from the WHO.
Yeah, I mean, it's the taking it down or not is less important. What they need is, so here they yell from the rooftops that it was not airborne, and then they have whispered, like in that interview or this other tweet from the chief scientist yesterday, no, it is actually airborne, but the message doesn't arrive anywhere. They have the capacity of yelling from the rooftops. They did it at a critical point when we were all scared and we were all listening at the beginning of the pandemic because we didn't know how it was transmitted. This had a profound impact. They need to yell even louder if we want to undo this impact 2 years later, and they refuse. They use whisper. There's a tweet here, an interview there, that if you are someone like me that's hyper aware of this, looking for the news, you find out. But the average citizen has no idea and doesn't understand what this means. Even if they hear the interview, they don't know how to interpret it.
Yeah. Sounds
highly technical.
Yeah. No, they should be shouting from the rooftops even more now with Omicron. It's even more essential.
Mm-hmm. Yeah. Anyway, so here we are at the end of March, and this is when I became more heavily involved. I had been doing some research on airborne during March, but Lydia Moraska, who's an aerosol physicist from Australia, that I knew from working on other topics, she contacts a bunch of scientists and says, WHO has, you said, loud and clear that this is not airborne. I think they're wrong. Do you wanna, I'm trying to form a group of scientists from different disciplines, from different countries, so that WHO meets with us, so that we can present the evidence that is airborne. So, and this happened very quickly. So we self-assembled. We call ourselves the group of 36 because there is 36 of us. And Lydia wrote to the top WHO officials, and Maria Van Kerkhove replied. And a few days later, on the 3rd of April, we met. We had a Zoom meeting, with Maria Van Kerkhove and other WHO officials, and the Infection Prevention and Control Committee that was headed by John Conley, which is a Canadian physician. And that was shocking. To this day, what happened in that meeting was shocking. Basically, we were told that we had no evidence. There was John Conley basically yelling at Lydia, "Where is the evidence, Lydia?" He must have said that 5 or 10 times in a very loud voice. And then, he's not a physicist. He was telling an aerosol physicist, Lydia, that she was wrong, that the aerosols were 5 microns, and we'll touch on that a little later. So it was really shocking. And we had a lot of evidence. In fact, it's clear now that we had more evidence for airborne transmission then than they had of droplet transmission and surface transmission. As we said, they were saying loud and clear it was going through surfaces. To this day, 2 years later, there is zero cases proven through surfaces. Then they had much less evidence, yet they were so confident, And what they told us, no, this goes through surfaces. And Dr. Sito from Hong Kong said, what you have to do is to wash your hands fanatically. So that was the message they were giving to the world. I assume they knew what they're talking about. So I thought, it must go through surfaces really well. We think it also goes through the air. So I started washing my hands fanatically and washing my groceries like millions of people around the world. And, and it took us months to stop doing that once it became clear that that was not true. But I never would have thought that the top experts assembled by WHO were so wrong, but they were absolutely completely closed to our input, And this is a summary from an interview of Lindsay Marr, who's another scientist of the group of 36. And she says, tension rose and Lydia was talking about the particle sizes, and one of the WHO experts abruptly cut her off, telling her she was wrong. His rudeness shocked her. You didn't argue with Lydia about physics. It's a good summary of the way that call went.
Yeah.
So now after the call, we sent a letter, an email that I coordinated. I said, okay, what are we going to say? And there were several obvious errors on their logic, that we will cover later. And then they replied a month later. They ignored the errors we had pointed out, and they replied with anecdotes that, according to them, supported droplet transmission. And so it was clear, and we had some more exchanges with them, but it was clear that they were completely closed. And they asked for our help to do some ventilation guidelines, but it was clear they only consider us ventilation experts, and we had nothing to say about disease transmission, And so we decided to write a letter and to have it signed by more scientists. So in the 6th of July of 2020, we published a letter in Clinical Infectious Diseases, which is a prominent infectious disease journal, that was written by the group of 36 and signed by a very long list that doesn't fit here, up to 239. And this, I think this was a pivotal change. Before this point, I was, contacting journalists I knew, and they basically refused to say anything or refused to interview us, even though we were investigating the Quire case. There were some interviews of some of the more prominent scientists, but it was much less. At this point, it becomes clear to the press, and I think to many in science, that this is not a wacko position. It's not like it goes by, the COVID goes through 5G or something, some other conspiracy, but that it is a serious scientific proposition, and there's many people behind it. And after this, we do get more coverage and more attention.
Yeah. Do you remember the precise date when the WHO began recommending mask usage? Because you mentioned before that throughout this period they were not recommending it. By the time of the April 3rd meeting, where they were shouting at Lydia and other experts on this, they were not recommending masks.
I think in June of 2020 they started recommending, but it was very limited, and it was really November or December of 2020. Where they recommended them a little more. And for a long time, for many months, they were recommending masks only if you could not keep 1 meter of distance.
Yeah.
So there were masks intended to stop the projectiles. The idea is that if these projectiles are going to come and you are less than a meter, they may hit you. If you are more than a meter, they're going to fall to the ground. So they were not, and this has also created a lot of confusion about masks and a lot of opposition because they say masks, but they don't explain what masks need to do. They need to be good filters, fit well to the face. They instead gave the idea that any piece of cloth that you put in front of your face is a parapet, and that's what you need,
Yeah.
Dr. Jimenez, it strikes me that when a group of 36 scientists who are quite respected in their field and well published are having what would be construed as a hostile discussion with other scientists, it befuddles the mind. A precautionary principle, in a situation where the world is facing a significant threat, this is not an issue of pride. It's an issue of trying to understand the science. Have any of these particular scientists, either from your group, have heard back saying, "Oh, we were wrong," or "We apologize," or "We thank you for the work you've done to bring attention to this matter"?
Not from WHO or from the scientists of the committee, as far as I know. Other scientists that were at the beginning kind of on the Droplet camp have done so and have changed their minds, and they have said they were wrong, but not these hardcore people who are there at WHO. And we can see, I mean, the next slide explains kind of the reaction from WHO. And I just took a couple of quotes that were published by the press. So this is a member of the WHO committee, Hunter from the UK. He's an expert of waterborne transmission. So he's not an expert even in droplets, but he's in the committee that decides how COVID is transmitted. And he basically dismissed us as ignorant. Most of them are chemists, engineers, owners of ventilation companies, implying we must have some economic interest.
Economic, yes.
Yeah. And he said they do not have a broad understanding of disease transmission, and the issue is more nuanced than many of them realize. So basically, that we are ignorant. What are we doing commenting on this, right? And now this is Benedetta Legranzi, which is basically working under Maria Banker-Hove, and is the person, the WHO official who supervises this committee. I mean, so we say here, she questioned the qualifications of driving the debate. Why don't we ask ourselves why these theories are coming mainly from engineers, other biologists, whereas the majority of the clinical infectious disease, epidemiology, public health do not think exactly the same, or they appreciate this evidence, but they don't think it's so prominent, and it was false. I mean, the letter of 239 contained many people who were experts on infectious disease transmission, but they were painting us as these people come from disciplines that are not relevant. They have nothing to say. And if you look at the composition of this committee from WHO, so the disease appears, and WHO convenes an international committee with scientists to decide how the disease is transmitted. That committee has 6 hand-washing experts, but it has 0 airborne transmission experts, 0 aerosol experts for a disease that we don't know how it's transmitted, and where there had been a lot of discussion, as we discussed earlier, that maybe it was airborne. Why wouldn't you invite? But it was clear that there was someone at WHO had their mindset that this was a droplet transmission disease, and they stacked the committee with dropletologists, and they systematically excluded anyone who knew about airborne transmission. And to this day, this is a problem. I mean, yesterday, finally, WHO, after 2 years, said that people should wear, healthcare workers should wear N95 or FFP2 in hospitals if they're available. But there is a footnote that says the committee doesn't agree. So so we have convinced the WHO officials, but the committee is still thinking that this is not true. So
that was the first pronouncement that healthcare workers should wear N95 or better? Or?
Yes, on the 22nd of December of 2021, after thousands and thousands of healthcare workers have been infected at work and died.
Yeah.
So it's
Jimenez,
it's progress, but
this is a period of time. Obviously, we had tremendous, the Diamond Princess cruise ship. I think you wrote an article actually on the restaurant in our second floor of a Chinese restaurant, where an individual who was seated, I think, several feet away, facing away from them, became infected. So there are all these well-documented events. Did the World Health Organization even bother to investigate these, to at least raise the question, perhaps we're missing the point?
So that's a good point, and the next slide has a point about that. But basically, another thing that I didn't know is that this field of medicine has been taken over by something called evidence-based medicine, and which is an attempt to make medicine more objective and pay more attention to the statistics of the studies, but it's really designed for things like vaccines or drugs. It's something so complex that the only way to see if it works or not is do a randomized blind clinical trial, or RCT as they call them. And that is at the top of the pyramid. If an RCT has a result, then you accept it. But if it is like the study, actually, the one we studied was acquired, they call that an observational study, and they have a pyramid that they say that's a low level of evidence. So basically they had an inherent bias, and they were not realizing that airborne transmission, aerosol transmission is physics. We can work from first principles, the same first principles that make airplanes fly or that allowed us to put a man in the moon apply to airborne transmission, and we don't need RCTs. But they are absolutely, to this day, they're absolutely close to this idea. So it's unfortunately this field of science have developed in a really dogmatic way that was really dangerous. But most of us didn't have contact with that field before the pandemic. But if we continue, so actually 3 days after the 6th of July, WHO released a scientific brief on how transmission works. And to my knowledge, this is still the latest scientific brief. So in a year and a half, they haven't updated the scientific brief. And I think this reflects the conflict within this committee that is completely against airborne transmission versus the evidence, and they don't manage to agree on what to publish. And there are several, so this is after, the restaurant case, the choir case, all this stuff has been discussed after our letter. And what they tell us is that it's still droplet transmission, and this occurs, and it reaches the mouth, the nose, or the eyes, by impact. And then they mention aerosols, but they treat it in a very dismissive way. This has generated hypothesis, and this theory suggests someone could inhale aerosols. However, this is not known. And they treat aerosols as something, yeah, maybe it's possible, maybe. I heard a number from WHO, from someone, a contact at WHO, that maybe it's 1% or 3% or something like that, So it's something, yeah, you can mention it, but it's not key to the pandemic. That was the internal thinking. They would no longer say it was disinformation or misinformation, but they said it was very unlikely. And something that's in the report that is very telling, is this last paragraph that they say, the close contact environments of these clusters may have facilitated transmission, especially if hand hygiene was not performed or distance was not maintained. And this is something that's actually endemic to this field of infection control, which is blaming the victims. If you get infected, you didn't do something wrong. You didn't wash your hands. You didn't maintain distance. And that's something I think they love about droplets. It's like droplets allow, it's not a failure of the infection control person in the hospital. It's a failure of the healthcare worker. And also they always go on about masks are dangerous because then you get the virus on the surface, and when you put it on or put it off, you may then get it in your fingers and get infected. There is zero evidence of this, but they trot it out every time to blame healthcare workers.
Could you elaborate a bit on this? I think this is a really, really central point. But just this issue of blaming the victim, blaming the individual, and not implementing the measures that have to be taken. And I know something that comes up a lot. You explained it. You participated in our webinar on October 24th, how to end the pandemic. But just this question of, people are confused about airborne transmission. But is it true that if you enter a room, that you don't have to be in the same room at the same time with someone who's been infected with, or someone who's infectious or infective, and that you can catch COVID even at a later time, if you're in the same room, and sort of, I guess, maybe how does this upend the whole, the individual approach, and say a worker starts their shift, and then on the previous shift someone had been infected with COVID and it's in the room, or if a student enters a classroom where someone in the previous class had COVID and their aerosols are in the room, is it possible for them to catch COVID, and sort of what are the implications of that in this instance of, or on this point of individual versus society?
What you're talking about is what technically we call long-range transmission. So that you have transmission in close proximity, very important. transmission when sharing room air at the same time, very important, all the super spreading. And then you have long range transmission. And this has been observed for measles or chickenpox. There are some cases for COVID. So the clearest cases are the quarantine hotels in New Zealand and Australia. There's also one in Hong Kong, where you have cameras and you see people were never in contact. And what we think is going on is probably the air is coming under the door in one room and then going under the door on the room across, and that's how they're getting infected. This is not, in our opinion, the major mode of transmission, or that you go somewhere where there was someone infected and you're gonna get infected. It can happen, but it's not necessarily the most important mode. What's more important is when you are breathing the air at the same time in the same room. But in any case, ventilation works against all of these modes. But yeah, in general, the attitude has been, both from the kind of the power within infectious disease, disinfection prevention people, as well as the governments, to take the easy way out, which is to, the droplets and surfaces. This was proposed, or this was the understanding of the scientists, but there is this kind of unholy alliance between these hardcore scientists and the governments, because the governments find this very convenient. Then all they have to do is to propose measures that people have to do, not things the government has to invest on, and it's the same. It's this culture of blaming the individual, unfortunately.
No, absolutely. I think those are really critical points.
If I may make an observation, Evan, just briefly, is that just this idea that personal blame and personal responsibility it's interesting, because that's something that the World Health Organization tends to constantly reinforce in their press briefs. But if I may just make a observation, the aerosol nature of these infections is what makes it a community, a threat to the community, as opposed to just a droplet transmission. Another way of stating it, that the aerosol nature makes it a community transmission and therefore requires a community approach to the control of disease. Would that be fair to say?
Yeah. And maybe I would say it in a slightly different way, that for a disease to become a pandemic, it has to be airborne. If it wasn't airborne, if it was a question of washing our hands and keeping distance or wearing any mask, whatever, we would have stopped it. If it was this thing, washing your hands is not so hard. There is hydrogel everywhere, but regularly, Delta arrives, Omicron arrives, we have another wave and we have another wave. And even though we're trying, or many people are trying to do the right things, and many people trying to do the right things still get infected. So for it to be a pandemic, I think it has, especially a fast pandemic like this one, I think it has to be airborne. And the next pandemic will be, I don't know how many variants this virus has left on it. But then if there is another pandemic, it will be another coronavirus or the flu, and it will be because it's airborne. Otherwise, it won't be a pandemic, or it will be a slow pandemic, not something like COVID has been. There has been actually Trish Greenhalgh and colleagues. So Trish Greenhalgh is a prominent medical expert. She's a professor at Oxford, and she was recently elected a member of the US National Academy of Medicine, which is rare for non-US doctors. And she's written a paper actually analyzing the resistance of WHO to scientists like myself and to the group of 36. And this is a quote from their abstract. Says, aerosol scientists were representing the heterodoxy, and they were systematically excluded from key decision-making networks and committees. And the dominant discourses defined these scientists' ideas and methodologies as weak, their empirical findings as untrustworthy or insignificant, and their contributions to the debate as unhelpful. I think that's a succinct way to put what we have faced during this whole pandemic. Is basically, what are you doing? You don't know about this. That's basically the attitude, and leave us alone. We are the experts.
When was this published? What was the date on that?
This article, it was published months ago, I think earlier this year.
Okay.
But it summarizes, it's a good article, kind of dense to read, but it does a good analysis of how, there were these two fields of science, and the field of science that had the power considered the other field of science as irrelevant, even though we were the ones who were right and had the evidence, but they,
right.
Anyway. So there is one other point that has been, I think is illustrative of what has gone on and illustrates kind of that neglect of the evidence. And that's on that same scientific brief of July. They say, among all the other things they said that we saw before, they say respiratory droplets, meaning these ones that fall to the ground and are projectiles, are larger than 5 to 10 microns. A micron is a millionth of a meter. And they say the aerosols are smaller than 5 microns, right? And this is physics. What they are saying is if they're larger than 5 or 10 microns, they fall to the ground in a meter or two. And if they're smaller than 5 microns, they stay floating in the air, right? Is this correct? We only have to go to the webpage of the CDC, the occupational medicine branch, not the infectious disease branch, has a tutorial about aerosols, and they tell us how long aerosols take to fall to the ground. And they say to fall to the ground in seconds, they don't need to be 5 microns, they need to be 100 microns, which is 8,000 times the mass of a 5 micron aerosol. This is an enormous error. I mean, and if it's 5 microns, it's in between these two, it floats half an hour. They're telling us that things that stay half an hour in the air are falling in seconds. You need to go to the surface of some special stars for this to be, it's just absurd physics. It's just ridiculous.
Do they still claim? Do they still claim this? The 5 micron?
Yes. Yeah. To this day they haven't corrected it. So
Dr. Jimenez, just for the viewers, on average, how big or how large are the aerosol particles of SARS-CoV-2? And what's the range?
The virus itself is very small. It's 0.1 microns in this unit. So the virus is very small. Now, the virus doesn't come on the air naked. That's not how it works. It comes in these balls of saliva respiratory fluid. And those are normally half a micron or larger. What we think it's important is starting with half a micron, going to several microns. And we humans generate many different sizes, but the ones that float in the air, which are this continuum of sizes, are the ones that are important, But the point here is that in a scientific brief from WHO, they had an enormous error that had been pointed out before and has been pointed to them afterwards. And they have to this day refused to admit it and refused to correct it. So this tells you when the aerosol scientist input is considered unhelpful, it's just to an extreme and ridiculous degree.
Yeah.
And this is, it's not like this is new. This is, rain, fog. This is the same physics, right? And if you go to this textbook from the 60s, or this is an article from the 60s where they were talking about rain. It says to fall to the ground in seconds, you need something that's 50 microns in radius or 100 microns in diameter. This is very well known. It's not like it's debated, Where do these aerosols come from? So going to Benjamin's question, they can come from different places and they come from different sizes. There is deep in your lungs, especially here, you have basically, if you exhale strongly and sometimes with older people, basically the walls collapse. And then when you inhale, a bubble develops and then it breaks, kind of like the bubbles from the kids. And then that makes very small aerosols. Then you can also have in the vocal folds or in the mouth, that the vibrations of the vocal folds or when you say a T or a P or something, you can also produce aerosols or droplets of larger sizes. So it's complex, but it has been studied and is relatively clear. So now, what happens with these aerosols when they are in the air? The virus, this is now the size of particles, and this tells us what happens to them when we inhale them. So the virus is here, but the virus doesn't come naked. As I was saying, it's more this range of sizes, and these, some of them, the ones that are like here, you inhale them and they come right out, and those are not going to make you sick. But for example, at 1 micron, 30% of the ones that you inhale are going to deposit inside of you. 20% in your nose and some deeper in your lungs, and those are the ones that may cause disease. And if they are larger than 100 microns, meaning they no longer float in the air, then they cannot be inhaled because they're floating so quickly that the flow of air cannot be inhaled. So there is a clear distinction between the droplets, which are the projectiles, which are larger than a couple of 100 microns, and the aerosols that float in the air and can be inhaled. Sometimes some of these scientists kind of have become aware of the error in their ways. They say, well, it's a continuum between droplet and aerosols, and that's basically an excuse to not admit the science. And it is not a continuum. It's actually, there is a clear boundary in the science. So now, why do they say this thing about the 5 microns? So we actually have written a paper where it's now published. It was a preprint when I made the slide, where we went looking for the citations. So you look at the scientific brief that I showed earlier, WHO said this thing about the 5 microns, but they didn't provide a reference at all to the literature. And then we looked for references and we traced the references, and they lead nowhere. They don't go, there is never a study, one cites another, cites another, says no, there's never a study that actually showed this, and it's incorrect. So of course it couldn't be shown, And we have known this thing that aerosols are really 100 microns was shown in 1934 by Harvard professor William Wells, and we have known since then. But what we think happens, looking at the history, is basically in the 1960s, they were starting to be worried, the CDC, about biological weapons, So they thought natural diseases could not be airborne, but they were worried about humans, the Russians, the Soviets making weapons with diseases that were aerosolized, that were airborne. And, at that point in 1962, finally, tuberculosis is demonstrated to be airborne. And tuberculosis, for infection, the bacillum of tuberculosis has to reach the deep lung because it can only infect the alveolar macrophage. So a cell that's on the alveoli, right? And to reach the deep lung, it needs to be 5 microns. So what we think happened is it was a period in which, they hadn't paid attention to airborne transmission, and they confused the two things. They confused the 5 microns of tuberculosis that are, because they need to reach the deep lung, with 5 microns being what falls close to the ground. And then they repeated for decades, and aerosol scientists have told them and they have ignored it. So that shows you kind of that this attitude of neglect of airborne transmission goes back a century, And in fact, there is a report on the smallpox in 1970, around there was an obvious case of airborne transmission of smallpox in a hospital where clearly there was no other possibility. And the paper that was written by some WHO experts says literally, finally, we ruled out surfaces, we ruled out other ways. So finally, we looked at airborne transmission, which was a possibility against which all the investigators were prejudiced. So, and that is the same mindset of WHO, the committee today. They were prejudiced because this was the belief in that field.
But in the decades leading up to the pandemic, Benjamin referred to this earlier, but there were breakthroughs in understanding of aerosolization, and that viruses could be aerosolized, correct? But it was still.
Yeah. I mean, really, there was a period between 1910 and 1962 where, the head of the CDC epidemiology branch, Alexander Langmer, said no disease is airborne.
Yeah.
In 1951. And in 1962, tuberculosis is shown. And in the 1980s, measles and chickenpox, which had been considered droplet diseases for 7 decades, finally are admitted to be airborne, right? But then the attitude is this attitude with smallpox, okay? We are prejudiced and we are only going to accept it when it can not be denied. And we see that playing out with the flu before the pandemic. The evidence is accumulating, it's overwhelming, yet they refuse to accept it. And the web pages don't even mention it as a remote possibility. It's just not there at all.
Dr. Jimenez, Evan raised an important issue, and since now at this point in the presentation, this error in judgment, this bias, how much life has this cost? I think we need to put that into a certain context. And I don't know if it's possible, but it would be interesting for the viewers to hear what you have to say on this.
I would call, I mean, this specific error we were discussing of the 5 microns is something more technical. I think what it is very useful for is to show how an obvious error pointed out by another discipline was ignored. So it shows the attitude of the field. In terms of the error of neglecting and being used so biased against airborne transmission, that scientific error, I think, is one of 2 pieces that have cost a lot of life in this pandemic. I think, as I alluded to before, there has been an unholy alliance between these infection control scientists that were completely stuck in these errors, and governments around the world who have found what they were saying very convenient. Because they, if it's credible, if WHO is saying that no, it's not airborne, then I don't have to do anything for airborne, and I can just tell people to wash their hands. And if they get infected, well, you didn't wash your hands well enough. Did you wash it 20 seconds? Did you wash it, and then you are out of the hook. You don't have to do much,
Thank you.
Okay.
Yeah.
So, there have been some admissions. So, for example, Anthony Fauci admitted in the 10th of September of 2020, he gave a talk at Harvard, and he said, he talked to Kim Prather and Don Milton, who are collaborating with us. They're scientists from our group, and he said, this 5 micron thing is totally wrong. And he said, the bottom line is there is much more aerosols than we thought. And he didn't say it this way, but the implication is there is many fewer droplets than they thought, So this really expanded. But, even though this was good, the CDC and still did not say clearly anything about airborne transmission, really. I mean, to this day, they have said it very timidly. And this is something that we have seen also, as it has become more scientifically embarrassing to deny airborne transmission. Many organizations will put things on their websites where they say things, in a more or less correct way, but then the messaging won't reflect that at all. They won't explain it to people, and the measures they take won't reflect it. So, if you attack them and they say you are not saying it, they say, here, it's on our webpage. But then that webpage is not something they talk about, it's just kind of, it's like a lawyery strategy. They can defend themselves, they've been saying it, but then they are not putting it in practice.
Yeah, just on that, on the Fauci on the last slide. When we interviewed Nicholas Smith for the inquest, he noted that in September 2020, around the same time, the CDC actually updated their website and basically acknowledged that airborne transmission was possible and even common. But then very shortly thereafter, journalists began to report it, and it became sort of more widely known, and they actually took it down off of their website. Do you recall that incident? And
very well.
Yeah, can you speak on that a bit?
Yeah, because we found out and we thought, oh, finally, and I wrote a very long thread on Twitter explaining what this meant and whatever. It was on a Friday that they posted it, and they removed it the next Monday. And it was explained, it was well explained, but they removed it and they put the old version, and then they have never really explained it clearly since. I don't really know what happened. Many of my colleagues have contacts at the CDC. And some people said it was political pressure. We know there was pressure from WHO. We don't know how important it was in the decision to remove it. There may have been pressure from the Trump administration. We don't really know. We know also that there was part of the CDC, the branch of these infection control people, that also said this should be taken down. Oh. So somehow that, so I don't know how the decision was made, but in a way you could think is some version of the unholy alliance of the infection control people inside the CDC and the same people from WHO put pressure on them, and the politicians as well. And we don't know if it was 10%, 90% or 90%, 10%, I guess.
Yeah, no, it strikes me that, it was sort of going both ways. I think I'm sure the Trump administration exerted, political pressure, but I think it's something we have to investigate further as part of the inquest is, what's been the relationship between the CDC and the WHO on this question. And I know the CDC exerts a lot of influence on the WHO and vice versa. They're in regular communication. And so I think it's interesting if you look at, we'll get to it a bit later in 2021, but the timing of their later acknowledgements, tended to coincide, within a week or two, they would have these pronouncements on airborne transmission. So yeah, I think it requires further investigation.
Anyway, so then, I mean, scientifically, this was October 2020, and there was a letter in Science that was summarizing it was a report from a meeting of the National Academies of Sciences, Engineering, and Medicine, who had a joint meeting on this, and they said it's airborne, And then Clinical Infectious Diseases, which is this major infectious disease journal, had a summary of the lessons learned, and it was written by the editors of the journal, and they said, it's airborne, and they said, the biggest surprise is that this has been surprising to people. So to them, it didn't seem surprising. So both kind of the scientific, fields other than medicine, the field of infectious diseases, many people were recognizing this, and it was becoming more scientifically embarrassing to continue to deny it. In November of 2020, so after these articles were published, suddenly, WHO, so Maria van Kerkhove, Maria Negra, start saying that ventilation is very important, and they even recommend numbers which are similar to our numbers, and we have to open the windows, but they don't say why. There is not a word of why you need ventilation. Right? Ventilation is very important to stop transmission. Now, if you are a scientist or you understand this, it's like if a virus is on a surface, ventilation does nothing. If you have a projectile coming at you, ventilation does nothing. Ventilation only works if the virus is floating in the air. If ventilation is very important, airborne is very important. But they didn't admit it for a long time. This was November. How many people have died since November?
It's been over a year until today.
Yeah. I mean, but later, it has been creeping. Like there was this update this was a document about clinical management or something. It's the first instance I know in January 2021 that they actually mention aerosols, without dismissing them. They say aerosols could spread, it was still not perfect, had errors, but and then it was really the 30th of April of 2021 that they mentioned, they don't say airborne, they say aerosols. They don't say airborne because airborne triggers, we think, that's what we've been told. If you say it's airborne, then that triggers things that you have to do. You have to legally give masks, good masks to healthcare workers. You have to do these things. And it seems that they were avoiding that, and they were using aerosols. That aerosols doesn't have any regulatory implication. It's a scientific term. But they finally post on their webpage that aerosols are an important mode of transmission. And the thing is that then they don't really adapt the measures. It was yesterday, how much is that? 5 or 6 months after that, after this announcement, that they finally said healthcare workers need to wear N95 masks, So even though they said it was aerosols, so it was one of these things that I was saying earlier. They put it on a webpage because it was scientifically too embarrassing not to admit it, because they were so behind the science, but yet they don't really adapt the measures, right? And it has been confusing and really led to some change, but not real change. Now, finally, yesterday, this is Soumya Swaminathan, who's the WHO chief scientist, said we need ventilation, whatever, to protect against this airborne virus. Finally, they're saying we need ventilation because of this airborne virus. And actually, just before we started recording, there was another announcement on the webpage where they are saying airborne transmission also more directly. So I think the fact that Omicron is spreading so quickly and is so obviously airborne is maybe finally forcing their hand, and they're finally admitting it. But how many people have died in the meantime, and they really need to shout from the rooftops, because we need to change perceptions, as we will see later. Really, governments around the world are either lost on purpose, or, either because they don't know or because they don't want to. They're doing all the wrong measures. Now,
shortly after this, it was actually, I believe, 7 or 8 days after this. It was on May 7th, 2021. It was a Friday. The CDC similarly accepted aerosols and airborne transmission on their website. But again, it was on a Friday afternoon. Basically, at the point when the news cycle would not pick it up, it would sort of be buried over the weekend. And it was not widely publicized. There wasn't a press conference. Rochelle Walensky didn't come out and say anything about that. But then 6 days later, on May 13, she did give a press conference, and that's the infamous date when she told vaccinated people that they've earned the right to take off their masks. And so I guess I was wondering if you could comment a bit more. What were your thoughts at the time, and what were sort of the implications of that? Now after that, the majority of states dropped their mask mandates, and we've seen the Delta surge, which has killed over 170,000 Americans. And now, we're threatened with Omicron. So maybe could you speak a bit on that and sort of what impact it had?
Well, I mean, that kind of followed this announcement. We know from conversations that the CDC is very sensitive. They don't want to appear behind WHO, so it was probably that. But they made that announcement, unlike the announcement in September that was clearly talking about airborne transmission. This one was very confusing. And they never mention aerosols, or they don't, not prominently in the case. They say it's transmitted by respiratory droplets. Now, and then they describe what respiratory droplets do. They float in the air and we inhale them, which means aerosols. At the presentation of the National Academy of Sciences, Jim Butler, who's high up at the CDC, the chief medical officer, I think, said that droplets are projectiles that fall to the ground. Yet in May of 2020, suddenly droplets had metamorphosized, and now they were behaving like aerosols. Why do they call them droplets and not aerosols or airborne? Because then they can keep recommending droplet precautions in hospitals, and so they really confused the issue. And I agree that dropping the mask mandates was a big error, as we see in retrospect. Yeah, so I mean, I think it reflects some of the same issues. I don't know what the motivations were behind the CDC, how much of it was political, probably a fair amount.
Do you recall that your experience that day on May 13? It was announced just before the nightly news and was sort of I guess presented as a celebratory moment.
Yeah.
What were your thoughts?
I was worried at the time the cases were going down and Delta had not appeared. I was worried that it was too early, and I think I said that in social media, like many other scientists did. But I wasn't sure it was a huge problem, But the problem was that if the virus came back again, it was going to be politically impossible to reimpose a mask mandate, as we have seen, even with Omicron, they are not willing to do it. So that was the problem. And unfortunately, I was hoping for the best, but the best didn't happen. We had Delta, and now we have Omicron. And the consequences of that error haunt us to this day.
Dr. Jimenez, you mentioned the point that dropping the mask mandate would prevent them from ever allowing mask mandates to go into effect. To the extent also that they're now saying it's a mild disease, and to celebrate the holidays if you've been vaccinated, gives me significant pause that this is just a further push to try to spread this virus as far as possible and move on with life and disregard the threat that this pathogen provides. Maybe if you can comment on that.
Yeah, I mean, I don't know if they want to spread the virus, but certainly they're not doing anything serious to stop it. So they are accepting, at least. I mean, I know people inside the CDC know that this is spreading faster than measles. So they know this is going to take over, and they know a lot of people are going to die. I mean, vaccinated people are more protected, but if they are not boosted, they can still die in significant numbers. And there is 40% of the US is unvaccinated. So, it's gonna, and we are also selling healthcare workers down the river. It's like basically we know there's gonna be a huge surge, even if it's milder. I mean, yesterday there was, the studies are confusing. Some say it's not milder, some say it's milder, and there is 40% less chance of hospitalization. But if you have many more cases very quickly, that only gains you 3 days, so it's, I mean, unless we're lucky and it's really much, much, much milder, of which there is no evidence now, we're going to have a huge surge at the hospitals, which are already overwhelmed, and healthcare workers are already quitting. So So that is, that is really serious and unfortunate. It's more something I would expect of the Trump administration and not of the current administration. But we see that some of the political and economic forces that drive these decisions, they transcend the political parties, it seems.
Yeah, I think the May 13 speech in particular was sort of encapsulates their vaccine only approach. This was when the Biden administration was promoting vaccines and saying there's a light at the end of the tunnel. On July 4th we'll declare independence from the virus, and so they basically dropped all other measures to try to stop the spread. And
Yeah, I mean, another detail is that in early February we wrote a letter with Mike Osterholm, who's a prominent epidemiologist, Kim Prather, and David Michaels, who's the former head of OSHA, and a number of other scientists, to the Biden administration and Fauci and the CDC, asking for them to basically enable the Defense Production Act of better masks and establish more regulations of the quality of masks. And basically, they did never even reply, because I think, I mean, at the time we were confused and we understood that they were on this vaccine-only approach and they thought that was not needed. Now, that would have helped a lot, to be prepared for Delta and then for Omicron. But to this day, they refuse. They're going to distribute some fast tests, but now the Omicron has evolved to the point that the antigen tests don't really catch everybody that's infectious anymore. So, the evolution of the virus has led to those being less protective, and they still don't want to distribute N95 masks, even though that would be much cheaper than the damage that Omicron is going to do.
Yeah, no, I very much agree with that. And I think just on the point of whether or not it's milder, I think they declared that almost immediately. There was within the first week they were already proclaiming that, or celebrating that this appears to be milder, and that people should sort of, essentially, it was disarming the population. And within just a few weeks, or within 3 weeks, it was clear that hospitalizations were surging in South Africa, in the UK, in Denmark. We're already seeing it in the US, in New York City. And in particular, I think one of the most troubling aspects of it is the surge in hospitalizations among children, especially under 5, which in New York, they're now at record hospitalizations for that age group, and many other states throughout the U.S. they're approaching the records. Within the next couple of days, they'll reach record figures. So it's deeply concerning.
I mean, really, since last summer, but as time goes, more and more evidence has accumulated that really airborne transmission is not just important, is the only important form of transmission of COVID-19. And this is a paper we published in The Lancet, reviewing many different lines of evidence, all of which point to airborne. Our conclusion was that it was the dominant route. And this has also changed the paradigm in other ways. I said earlier, when they saw that transmission was similar to the flu, these infection control scientists thought, okay, if it's like the flu, it must be a droplet. Now, what we have since published a review article in Science, where we review the literature on the transmission of respiratory viruses. And it's clear once you look at the actual evidence that it's not just COVID-19. In fact, we have more evidence for the flu being airborne than we have for COVID-19. And we have much more evidence for those than we have, for example, for measles, which everyone agrees is airborne. Right, and also viruses like SARS and MERS that are 2 previous coronaviruses, they were also airborne. But this had also been suppressed and not really acknowledged by the scientific establishment.
I guess I was wondering, could you maybe speak a bit further on those and sort of the experiences, if you're familiar, the experiences with SARS and MERS, and because those were just a couple decades before COVID-19, and there were these advanced warnings. We noted in our statement on the inquest warnings by Dr. Michael Osterholm and dozens of other scientists about a potential pandemic, but there weren't preparations really made.
Yeah, it was clear, for example, with the first SARS that it was airborne, and there were reports, even WHO accepted that, and there are documents where they say this. But But the hardcore infection control scientists like Dr. Conley and Dr. Sito pushed back, and they said, no, it's not airborne. And for one reason or another, those were the people that were put in charge at the beginning of COVID. So yeah, I mean, it was, and it's not so difficult to understand. If something is airborne, it's much more likely to become a pandemic, you know. So why didn't prepare for it? I think it's, again, it was impractical. It would require more expensive measures that, you know, and nothing, you know, governments don't want to spend on something that's not the crisis right now. You know, even the crisis right now, they don't want to spend. But if it's some future pandemic, you know, there's something that looks nebulous, is like an asteroid is going to hit the Earth. Well, whatever, this is some distant danger, right?
So,
Yeah,
so Dr. Jimenez, you bring up a very critical point. So if SARS-CoV-2 and MERS were confirmed that they were airborne at that time, you're saying the fact that it would require a significant change in a paradigm in how pandemics are controlled and how governments are prepared, that it would require a significant shift in this preparation by this, for the same reasons that they didn't want to say it's airborne now, they didn't want to say it's airborne even back then. Would that be fair?
Yeah, of course. I mean, if they have resisted for 2 years when it's obvious and where people are dying and the economy is really hurt and whatever, imagine now in, let's say in 2018, when there was no pressure, you know, it was just almost an academic question, you know, why would they admit it and have to do things about it when, you know. Yes, I think it's been the same two types of resistance have been the problem all along. And this climate was reflected, for example, here around the time we published this paper. Lindsay Marr, who has been doing research on airborne pathogens for more than a decade, she posted on Twitter that, you know, she suspected that aerosols were the dominant route, but she had been afraid to say so because she had been ignored and ridiculed. So she's a scientist saying things were airborne, you know, but the mood in this field was like, if you said this, you were taken as being crazy. You know, it was very few people, very few scientists were saying this. You know, I mean, some like Lindsay Marr and Lydia Moraska and Julian Tang, Don Milton, Mike Osterholm, you know, but compared to the size of the field and the composition of these committees of WHO or the personnel of the CDC, this was a very small minority.
I just had a quick follow-up question. I was wondering if you or one of your colleagues has done a investigation of how much it would cost to renovate filtration and ventilation for every indoor setting, you know, in a given geographic area, because, you know, this time period, you know, the decades leading up to COVID-19, just in the US, you know, they were spending hundreds of billions of dollars, you know, in total trillions of dollars on the military, you know, on, you know, there's a vast expansion in, you know, this defense spending and all these other, you know, there's a massive transfer of wealth to the rich coming out of the 2008 financial crisis. There's plenty of funding around, but it's been diverted into other, you know, things that aren't really for, you know, they don't provide any social benefit. And I guess I was wondering if you know or have any estimate for how much it would cost to implement airborne protections and renovations.
There are estimates that have been published that even for the flu, even for the seasonal flu, the cost of the flu in terms of death and disease and loss of economic activity is something like 50 times more than what it would cost to do ventilation properly. So it is, or another estimate is that if you're building a new building, the cost of making it pandemic proof or having a very good indoor air quality is 1% of the cost of the building. So it's not like you say, oh, the cost of the building is going to double and we cannot build it anymore or something. No, it's 1%. But of course, if this is not mandated, you know, 1% of $100 million is $1 million, and you'd rather not spend it if you don't have to, right? So
cuts into the bottom line.
Yeah, that's the situation we find ourselves in. And yeah, I mean, it's not expensive. I mean, it's not even expensive compared to the economic losses, even if you don't count all the death as an economic loss. Just the slowing of economic activity that the pandemic has brought is trillions of dollars, and with 1% of that we could be, doing ventilation, giving masks, but so this is why it's stunning, this refusal and this very short-term mentality of the governments.
Yeah, absolutely. And I mean, just during the pandemic, the billionaires in the U.S., I believe, have amassed over $1.8 trillion, just in the up through August 2021. So there's been, there's plenty of money around, but it's not being used for these socially necessary purposes.
Yeah, no, agreed. Okay, so continuing, but I would say now finally we're assisting to the end of the Droplet Dogma, which is something that started. I will review the history in a little bit, but basically started in 1910 and is basically unable to explain the observations. And as Thomas Kuhn said on the structure of scientific revolutions, these scientists, the Droplet scientists like John Conley at WHO, they are faced with a failing theory and they're coming up with epicycles, or the equivalent of epicycles. It's a droplet, but it's a droplet that floats. So it's like an aerosol, but we call it droplets, or it's situational airborne, or it's airborne, but only under, which are ways of not being embarrassed by the evidence, but still not admitting the scientific truth. So coming back to the end of the presentation is like, why has there been such resistance that it's taken 2 years into the pandemic for WHO to say it clearly, and we will see if they actually do a press conference and say it as clearly as they should. So I think that there is 2 parts, as I said. One is the history. I think the history set us up. If it wasn't for this history, we wouldn't be here. And then there is the government convenience. Why the history? Because we started the pandemic with this droplet view being dominant in all the scientists and all the public health organizations, WHO, the CDC, and they were absolutely convinced because they had been thinking droplets were it for 110 years. And aerosols were something that thought was unimportant, and they had not studied it. They didn't understand. Every time they opened their mouth about aerosols, they made huge mistakes. So let me give you the 3-slide version of the history. We start with Hippocrates, so 400 years before the current era. He writes that whenever a lot of people get sick, we have to suspect the air because it's what we have most in common. And otherwise they think there is some kind of miasma, something that comes through the air long distances that gets you sick. This becomes the dominant theory of disease until the 1850s. Basically during all of humankind history until the 1850s, we have been really scared that diseases are going to come through the air. And they thought that cholera, malaria, malaria means mala area, bad air. We thought all diseases came through the air, right? And it really frightened people, and everybody thought this. Now, in 1910, Charles Chapin is an American public health researcher, and he comes just like a couple of decades after germ theory has been accepted from Pasteur and Koch and Lister. So finally we have learned that it's germs, that germs have to get to you, and that's how you get infected, right? But we don't know exactly how the germs come to people. But we have thought, as I said, for centuries that they were coming through the air. But then cholera is shown to go through water, and puerperal fever is shown to go through the hands by Semmelweis, and then malaria is shown to go through mosquitoes. So suddenly the diseases going through the air starts to be like something. Well, the diseases actually don't go through the air. And he pushes it to the extreme. He's trying to say that contact infection is more important. It's kind of his pet theory, which is important. But he finds resistance, like everybody. People don't pay attention to him; they resist, and they especially resist because people still believe diseases go through the air. So he writes a book in 1910 where he says we don't really know if airborne transmission happens, but it's impossible, as I know from experience, to teach people to avoid contact infection, which is what he thinks is important, while they are firmly convinced that the air is the chief vehicle of infection. So he says, we don't know, but this air infection is really getting in my way. So we're just going to discard it. We're just going to say it doesn't happen, and people who want to prove it should prove it. So this is droplet theory. And he was the one who came up with the spray-borne droplets without evidence. He just came up with this. He made it up. But he was a very respected researcher, and this theory became dominant. And then from around his time, even though we had the Spanish flu and many other diseases, as I said, for 5 decades, nobody thought diseases were airborne. And the problem is that he was so successful, again, that he's totally embedded this field. So Alexander Langmuir was a nephew of the Nobel Prize Herbert Langmuir, and he was the first and longtime director of the epidemiology branch of the CDC. And he described in 1967 that Chapin was the greatest American epidemiologist. And in 1951, Langmuir said, it remains to be proved that there is any disease that airborne. They were worried about the Soviets developing airborne weapons, but natural diseases were not airborne. And they were misinterpreting the studies, so they were thinking, they did these experiments during World War II, in which they say, okay, if we allow more space in the military barracks, less people get infected, less recruits get infected. Therefore, it's airborne because if it decreases with distance, those are the droplets that fall to the ground. Airborne wouldn't change with distance, which is an error. Airborne changes with distance. If you are nearby, you inhale more of the air that leaves another person. If you are far, you inhale less. So the head of the CDC epidemiology branch and the whole CDC were misinterpreting the evidence that was in front of their face because they had the wrong theory. And this has been going on for a century. So this is just how embedded these beliefs were, in the history. And I'm sure they were doing it in good faith, but they had the wrong paradigm, right? So we start the pandemic, and it's really, these people are really convinced, and they provide cover for the other reason. There is an asymmetry of power, as we saw in that study. The WHO committee is full of hand-washing experts, 0 airborne experts. They also told us in the meeting with WHO, well, if we say it's airborne and then some countries don't have N95s and that kind of thing, from their point of view, if it was airborne, if it was 1%, it wasn't worth the creating a panic about it. That's kind of the way they were coming from. And once this has become clear, I think there is certain people who were behind saying it was a fact that it wasn't airborne that don't want to lose face. And certainly Maria Van Kerkhove and Mike Ryan at WHO come to mind, but there is many more. But then the other really important thing is that once they said this, governments and organizations were like, oh, this is pretty convenient, because the responsibility if someone gets infected is like, is this blaming the victim? You didn't wash your hands, you didn't keep the distance, is the individual responsibility. But if it's airborne, in a shop, in a school, in a government building, in a mall, in a company, it's not individuals who can clean the air. If you get infected because you breathe infected air, the organization didn't clean the air, didn't protect you. And this brings with it legal liability, and it brings the responsibility of doing ventilation, which is, as we said, is not costly compared to the cost of the pandemic, but it is, we're talking billions of dollars now. So, so it's something that it requires a serious investment, and they much rather avoid it. And so where has this situation led us? So I've been compiling a thread in recent days just with, as of today, as Omicron explodes, where are we, thanks to this ignorance of the science? So this is one of my native country, Spain, where they are saying yesterday that they're gonna do one new measure to stop Omicron, which is to have masks outdoors. This is an indoor pandemic. Outdoor transmission is 20 times lower. But it's just the one measure they can do, so they can, it's again imposing it on individuals.
It's the cheapest they could find.
The cheapest they can find. It doesn't bother anyone. They can keep bars and restaurants. So someone sent me a comic of all these people in a bar without masks, and then someone says, well, I'm gonna go outside. It's like, hey, don't forget to put your mask. It's just absurd. But it's really worldwide. I mean, here we see, a week ago, the British Prime Minister went to get a booster, and he was disinfecting the chair. I mean, it's just the chair. I mean, it's like, it doesn't go through surfaces, but it certainly doesn't go through your trousers. It's just absurd. And here in Mexico, again, December 15th, they were spraying disinfectants on people before they entered a public space, but these people are wearing poor quality masks.
They still do that in school districts, certain workplaces. They've done that throughout the pandemic, which they've shown can be hazardous. You're spraying people with chemicals.
It's hazardous. It's pollution. It's poisonous.
Yeah.
now here we see in Switzerland, so this is the parliament of Switzerland, and they don't have masks, but they have these barriers, these plexiglass barriers. Now, there is a study in Science in February of 2021 that says that the schools that have barriers had twice the transmission of the schools that didn't have barriers, because that impedes ventilation. So these parliamentarians in Switzerland are exposing themselves to transmission, and this is 2 weeks ago. Now,
Yeah.
in India, there is a government app that says it's a myth that COVID is an airborne disease, and it goes through droplets when one coughs and they fall to the ground. So it's widespread in many countries. So this was posted today. In Russia, there was a press conference of Vladimir Putin, and they had this machine that was spraying disinfectants on the journalists before they came in. But then people were not wearing very good masks or not masks at all. And this is another one in Spain. A regional government is buying transparent masks. So this is like a cloth, like what women use for the leggings kind of thing, like some cloth that's pretty open, that's transparent and doesn't do anything for it, but they're going to give this to deaf people. So so it's criminal.
I think these slides are very significant, and it's I think it's hard not to have sort of a gallows humor at this point in the pandemic. It's just, but I mean you have to bear in mind that these are the policies they're implementing. You saw the officials wearing masks outside. It's incredible, and we're now heading into the 3rd year of the pandemic, and these policies, I just checked, it looks like you're up to 82, or I guess Russia has 84. Just dozens, almost half of all world governments are implementing these backwards, totally unscientific policies that will do nothing to stop the spread of Omicron and further lead to potential mass infections, hospitalizations, deaths. Do you have any thoughts on that?
Yeah, I mean it's really, really sad, but what can you do? I mean, at least I hope this compilation seems to be attracting some attention, and it makes it so obvious. And something that's curious, all the countries, they think, oh, the foreigners, they don't like the international attention. So it's actually, I'm already aware of some changes in some countries, which I think are a consequence of this attention, But I think obviously it's going to take a lot more. I mean, this needs to come from the big institutions. I can push. I mean, I think scientists like me can push WHO, can push other scientists, but really, it needs to come from the top down. I mean, something I've said many times is that WHO works in most of the world, or CDC in the US, is an intellectual dictatorship. And when I have told this to WHO officials, they're like, no, we welcome discussion and we invite. It's like, yeah, that's true. But once you decide that you say something, there is no government or regional government or a school principal or who's going to disagree with WHO in public. And it's going to say, no, WHO says this, but in reality is that, because that person will be in a very vulnerable position. And just nobody does that. So whatever WHO says becomes, and especially in the poorer countries, I'm a native Spanish speaker, and I've done a ton of work in Latin America. And it's like, their WHO is king. It's like whatever they say, everyone repeats like a parrot. Or I've also worked a bit in the Philippines and Thailand. And again, is their local health officials and their WHO representatives. I mean, they just parrot whatever WHO is saying, And there was one case that a journalist in the Philippines wanted to interview me about CO2 meters and whatever. It was like in April last year. And then I talked to him and he said, I talked to the health officials. They think this is baloney, that this is bonkers, that these CO2 meters don't do anything. So then I explained whatever. And then that was just before WHO accepted on the 30th of April that, no, it does go through aerosols. So then he wrote to me a couple of days later. And he said, the same officials say, yes, it does go through aerosols. So it's like, I mean, a lot of the third world and a lot of the developing countries, the WHO says right, they go right. It says left, they go left. And they don't have the capability or the confidence to contradict WHO,
Yeah. Well, I think we'll get into it a bit later on, but our emphasis is really, we have to build up a, mass movement of workers and really educate the population on these issues, which I think, you and other scientists have really done an incredible job on social media. That really has to be amplified significantly. So, but
Yeah, no,
the major,
I
go
agree. I
ahead.
mean, is that back to that quote from Margaret Mead? Never doubt that a small group of thoughtful
Yeah,
people, committed people, can make change, and is the only thing that changes things. I mean, this pandemic certainly has taught me that lesson very
yeah,
clearly.
yeah,
Also, the last thing is like, I think this error has become obvious, and once the scientific error becomes obvious, then the politicians have more trouble hiding behind it, and especially if So I think we are in a moment of change. I don't know if the change will be rapid because of Omicron. These things are unpredictable, or if will be more gradual, and we will be fighting about this for a couple of decades. But I think we will not go back to where we were at the beginning of the pandemic. I think it's a mainstream opinion, even if not accepted by everybody, that COVID and all respiratory diseases go through the air, and it's not, oh, the flu is coming, we have to wash our hands, and we have to accept many people will die from the flu. We can do lots of things. And so this knowledge has huge implications. And I mean, there was something poignant. This William Wells, who for his entire career, he was trying to show that diseases were airborne. And he was rebuffed. Alexander Langmuir of the CDC was laughing at him and saying, no, there's no disease that's airborne. In 1945, he wrote an article in the predecessor journal to Science, where he was saying basically, we realize diseases go through water or through food, and we have really cleaned up water and we have cleaned the food. And these were major efforts. Providing clean water to everybody was an enormous engineering effort, but we have been successful because we've tried. And on the other hand, for the air, we have done nothing. We have not ventilated, buildings are poor ventilated because diseases don't go through the air. Now, I think it was in February of this year, 2021, I was a co-author on a paper led by Lydia Moraska, also in Science, 60, how many years later, 70 years later, or whatever it is, where we said the same thing almost with the same words. Is things as of 2020, buildings continue to be poorly ventilated because diseases are not thought to go through the air. And this really needs to change, and really, and there are enormous health benefits for humankind if we take this seriously. And I hope it doesn't take, I hope we are talking years and not decades.
yeah, absolutely. Go ahead, Benjamin.
Yeah, I mean, I've just been listening to Dr. Jimenez speak, this hour to hour and a half, and it's been quite a sobering experience just to listen to him. I mean, one of the things we haven't raised is that last year the flu disappeared. We've always been told, the flu is going to happen seasonally. We're going to get hit some seasons worse than others, but yet we were able to essentially, using the meager measures we did, to bring it to almost halt, which is incredible when you think about it. But the other thing that I think his presentation raises as a very important point is that science has become a casualty of politics. So we've been accepting that 110-year error is not just a benign issue, as he just mentioned about Dr. Wiles. It's not as benign as it sounds on the surface. The evidence has been irrefutable. And yet, country after country, has intentionally avoided raising the science to the level that it can guide policy. And however, policy and politics have been used to bend the science to the conveniences, that have proven tremendously costly for humanity. And now that we're, seeing a coronavirus that's been shaped by these policies, becoming the most contagious pathogen known to man, what does it tell us? And virologists have said, that the coronavirus still has more room to mutate, so what comes next, and I guess the real question is, will the World Health Organization and world leaders really heed the science in the next pandemic? I mean, these are very important, thoughts, and so I really want to, give my appreciation to Dr. Jimenez and his colleagues for the tremendous work they've done in a very difficult time.
I mean, if I may react to that, I mean, then if what's going on right now, when there is exponentially rising cases in many countries, and every country has scientists that can see the writing on the wall. This is going to be an enormous wave that's going to create a lot of disease and death. they are still not doing the right thing. So if they don't do it now, I don't think they're gonna do it very quickly. But now, what may come next is, what produces variants is transmission. It's just when you infect people, you give the virus opportunity to mutate. And as you quoted, or Evan quoted at the beginning of this, there is probably going to be billions of people infected by Omicron. So we are going to give it, that's as many or more people that have been infected in the rest of the pandemic. So, and as many or more chance of mutation as the virus has had in the rest of the pandemic. So it would actually be surprising if we wouldn't have new variants, Omicron 2 or whatever they decide to call it, that maybe is even more problematic, and we are also, we have now an evolutionary pressure, right? That is that if the variant infects a lot of people who are vaccinated, and a variant, there is some mutation that allows evading the vaccines better, that is going to have another advantage, So are we going to select another variant that's like Omicron, but now it doesn't respond to the vaccines? So that's another reason why it is irresponsible to allow mass infection, which seems to be the policy, certainly in the US, but in most other countries.
Yeah, no, I think those are very critical points. And I think it's a good segue to my final question, which is it's a bit long, but I know you're not an epidemiologist, but just given your extensive work during the pandemic, I was wondering if you could speak to the issue of elimination. And throughout the pandemic, including at the October 24th webinar that you participated in, the WSWS has called for a globally coordinated emergency response to utilize all public health measures available to eliminate COVID-19, eliminate SARS-CoV-2 worldwide. These include the temporary closure of all schools and non-essential workplaces, with social supports for all affected workers and small business people, combined with full airborne protections for essential workers, as well as mass testing, contact tracing, the safe isolation of infected patients, and the rapid vaccination of the world population, as well as other measures. And before the vaccines were even developed, we saw this strategy implemented in New Zealand, Vietnam, and other Asia-Pacific countries, most significantly in China, which has maintained a zero COVID strategy throughout the pandemic and has only experienced 4 deaths officially since April 17th, 2020, in a population of 1.4 billion people. And in contrast, the IHME, which projects that in the coming months, there could be up to 3 billion infections due to Omicron. They've estimated that over 12 million people have died globally since that same time, that during the time period that China's only had 4 deaths, over 12 million have died in the rest of the world. And due to Omicron, today we're on the verge of surpassing 1 million official global infections just in one day, which will likely happen either today or tomorrow. And so just given what we've discussed, given the massive danger posed by Omicron, the possibility that potentially millions more people could die from Omicron, we're not sure the exact infection fatality rate, but this will strain hospital systems, cause a surge in excess deaths, and so on. Just given that really dire situation, and also, as you said, the possibility that a more dangerous variant could evolve very quickly. Would you still support the fight for global elimination or zero COVID? And if so, I was wondering if you could speak on sort of what are the necessary measures that must be implemented in essential workplaces that have to stay open in order to keep those workers safe while schools are closed and non-essential workplaces are closed and people go into lockdown.
Well, it's a complicated question, and I'm not an epidemiologist, so I'm gonna give you my view. I think the real missed opportunity was March, April 2020, where we were all willing to accept our measures, and where lockdowns were implemented, and we got close to elimination. And then the drama is that then we relaxed measures and we didn't follow up, because then the virus was not as transmissible, and we had more motivation. Now, as we have let variants develop like Omicron, that is so extremely rapidly propagating. I mean, I hear some epidemiologists who still think elimination is possible, others that think that is just hopeless. I mean, partially because the virus is so contagious and partially because there is a complete lack of political will. So I think, but I think we should use more aggressive measures, whether it is for elimination, if that's deemed achievable, or if not, just to flatten the curve and to protect healthcare workers and to try to give time for more people to be vaccinated. I mean, there is something I don't think we have touched on, which is also long COVID. There's a lot of people who get long COVID. So it's not just about how many people die in the Omicron wave. Many people who have COVID, even mild cases, then, I mean, there are estimates that it's 10% of the people who get COVID, right? So if 3 billion people get infected and 300 million, or let's say it's only 100 million people that get chronic problems, I mean, that's an enormous burden for health and for workers and everything. So, I mean, so it's really, I mean, and there are, I mean, and the public health measures are well known. I mean, and we don't have to reinvent the wheel. We just have to look at what Vietnam and New Zealand and China and Korea and some parts of Australia have been doing. You have to support people if they are sick. Then you have to, like it was the case in Korea, they will put them up in a hotel, bring them food, and support them in the ways they need it, so that they didn't have to go to work despite being sick, and do a very good contact tracing, and all these measures, and testing, and of course attention to airborne transmission. If there is a time that there is someone who's infected and we escapes detection and goes and shares the air with others, we want to limit the number of new cases that come through that. So, I mean, it's clear we have the tools to do infinitely better than we have done, and it's criminal that we haven't. But politicians have other goals, mainly to win the next election and to do things that they think are popular, and it's like if you impose a mask mandate or a lockdown or whatever, everyone is affected by that. While if another person in 1,000 dies, well, only 20 or 30 people out of that 1,000 are going to find out, and there is more votes on being lax than there is in being stringent. I think that's the way they seem to do the calculus.
Yeah, no, well, I agree very much that the lack of political will is really central, and I think really it's the political will of those who are in power, and I think we have to really fight to as I said earlier, build a mass movement in the working class. The only way that we can really implement the elimination strategy and really utilize all of the tools that we have at our disposal is by the involvement of millions of people on a world scale, and that it has to be really developed in that fashion, and really, as you said, sort of through a grassroots movement, through rank and file workers organizing themselves at their workplace, at their school, which I think we're starting to see. Actually, there's a school in Philadelphia where a student just died last week, and the 17-year-old, she was an honors student, senior, and the teachers organized a wildcat sick out and basically pressured the administration to switch to remote learning. And has since spread to 6 other schools throughout Philadelphia. There's over 200 schools that have switched to remote across the US. So I think really, developing an understanding of the science of airborne transmission, of elimination on a broad scale is really the only, and really educating the public on these issues and really stressing the need to take urgent action is critical. And we are still fighting for elimination. I think if every essential worker were provided with P100 masks, elastomeric respirators, and we actually closed all the schools and non-essential workplaces, it could it still would be possible. It would obviously be incredibly difficult, and we'd have to really use those 2 months to the best of our advantage to really bring cases down as low as possible and set the basis for elimination. But I think it's something that can really only be determined in practice as well. It's sort of in the abstract. It can't really be decided that way. So Benjamin, did you want to add any additional points on this before we wrap up?
Well, I think to the points that Dr. Jimenez and you raised, it requires, understanding that we have to put life before profits. The only purpose of society and community is that we live, and work together. And in this regards, that life is critical. I mean, the fact that 1 in 100 elderly people have died, and over 200,000 people who are between the ages of 18 and 64 in their working prime, or it's the #1 leading cause of people who are between the ages of 45 and 54. These are, and the other issue is the life expectancy in the United States has dropped by 1.8 years. I mean, these measures are statistics, but they live in the homes of people. They scar their consciousness. So these are very, very certainly, terrible, situations that the pandemic is in.
Okay, well, thank you again, Dr. Jimenez. I think this has been really critical testimony for the global workers inquest into the COVID-19 pandemic. And I think this will have a huge impact on workers as well as other scientists to really come forward and to share their experiences, their areas of expertise on the pandemic. So thank you again. At the WSWS, we followed your work very closely during the pandemic, and it's very much informed our analysis and coverage, and frankly, the work that you and many other scientists have done in raising awareness about airborne transmission has been heroic. And at the very start of the pandemic, your findings and those of the 36, the group of 36, and then the 239, those findings should have been front page news. They should have been reiterated each day on the broadcast news, and really, pushed out on every social media platform to educate the population. But instead, you've been sidelined, maligned by the official institutions, as you spoke on today, with devastating consequences. And as you said, if airborne transmission had been explained at the start of the pandemic, millions of lives could have been saved. We could have brought this to an end very early on. And as Benjamin just said, I think it's clear that there are strong political and economic forces that have determined official policies since the start of the pandemic, and which continue to this day in the US, the Trump administration, as well as the entire political establishment and the corporate media continuously downplayed the threat of COVID-19, despite knowing by January and February 2020 of the dangers posed. And even as Trump told Bob Woodward, they knew about airborne transmission. And Trump discouraged mask wearing, refused to provide adequate PPE to healthcare and other essential workers, leading to the deaths of thousands. And then he forced open the schools without any protections, leading to millions of infections among children. And in all essentials, these policies continued under Biden in the US, which adopted a vaccine-only mitigationist approach. And after telling people to take off their masks on May 13th, they have refused to implement a nationwide mask mandate during the Delta surge, and now under the Omicron surge, despite polls showing that the majority of Americans support such mask mandates. And I think their response to the Omicron variant has really been to disarm the population, to prematurely declare that it's milder without sufficient evidence, and now to essentially continue the vaccine-only approach, to blame the unvaccinated, while adamantly refusing to carry out any of the necessary measures to stop the pandemic, including lockdowns. And as of today, the IHME estimates, as we said earlier, 12.5 million people have likely now died from COVID-19 worldwide since the start of the pandemic. And the vast majority of these deaths were entirely preventable. With Omicron, 3 billion are forecast to be infected in the next 3 months. And given the current infection fatality rate, or given that the current infection fatality rate is far higher than the flu, this could mean millions more die needlessly. And these surges will just continue and produce new variants that are potentially even more dangerous. So our position is that this has to stop now. In order to stop the pandemic, we have to understand how we got here and really hold accountable all those responsible, which is the purpose of the inquest. So I'd urge all of our viewers to share this video widely with your coworkers, your family, and across social media. And if you'd like to participate in the inquest and give testimony on your experiences during the pandemic or your area of expertise, please fill out the form below the video and we'll contact you today. So thank you again, Dr. Jimenez, for all the work that you do.
Thank you for listening.